Hello, my name is Dr. Vonette Fay, and I am a professor of clinical nursing at the University of Texas Health Science Center School of Nursing. The following presentation is for the use of certified nursing assistants and caregivers. The following slides are not intended for continuing education credit. This project is funded by a grant from the Health Resources and Services Administration, or HRSA, of the Department of Health and Human Services. The grant was initially funded in 2007 with renewed funding for 5 years beginning in 2010. Objectives for this presentation: the successful student will be able to define the term restraint, list biopsychosocial challenges associated with restraint use, discuss restraint alternatives, and identify guideline-specific actions that must be taken if restraints are ordered. Let's begin by defining what a restraint is. It is a physical or chemical means to restrict voluntary movement or behavior. As nursing assistants or caregivers, you are probably more familiar with and will be using or trying not to use physical restraints. And physical restraints can be ankle or wrist restraints, vest or jacket restraints, mittens or mitt restraints, belt restraints, raised bed side rails, and using geriatric chairs with the tray tables attached. In the past, restraints were often used to prevent wandering, falls, injury to the patient or to others, to prevent patients from pulling out tubing that are being used for treatment, such as IVs and feeding tubes. Unfortunately, restraints were abused by caregivers in the past, and as a result of this abuse, new laws were passed that address the use of restraints. Let's talk a little bit more about restraints. Long-term care facilities, in light of the new laws that were passed, are prohibited from using restraints unless medically necessary. In any care setting, restraints are only used as a last resort, and these restraints must be ordered by a physician, and there are specific guidelines that exist about carrying out these restraints. And it is against the law for a staff to apply restraints for their own convenience or for discipline. Physical problems associated with restraint use. There are physical problems that may result from the use of restraints, and they generally are associated with the lack of mobility or the ability for the patient to move at will. And these problems include pressure ulcers, pneumonia, risk of suffocation, reduced blood circulation, stress on the heart, incontinence, constipation, muscle atrophy, and this muscle atrophy leads to decrease in balance and increases the potential for falls. It also leads to loss of bone mass, poor appetite, and even malnutrition. It can result in severe injury and death. The psychological problems associated with restraint use include depression and withdrawal, sleep disorders, loss of dignity and self-esteem, loss of independence, stress and anxiety, and increased agitation. The use of restraints has been decreased greatly in the nursing homes, but we need to begin to talk about what are restraint alternatives. So how do you define a restraint alternative? It means that we are using alternative interventions in place of restraints to help the patient, or that we can reduce the need for restraints. Research studies are showing that restraints are not needed when creative interventions are utilized. So let's look at some of these alternatives. And when we talk about a restraint-free care, what does that mean? It means that restraints are not kept in the facility or are used for any reason. So what are some of the examples of restraint alternatives? Restraint alternatives can be safety measures that are used to prevent accidents, and these can be something as simple as improved lighting. Make sure that the call lights are within reach and that we respond to these call lights promptly. Help the person to ambulate when he or she is restless. An exercise plan should probably be included in the care planning. Some facilities may employ activity aids which help with ambulation and increasing activity among the residents. We want to provide activities for those people that are wandering at night. If you have someone who's up at night and wandering, we need to begin to try and find something for them to do. We want to encourage activities and independence. And for those residents that are able either to ambulate to an activity or to be taken from their room in a wheelchair, they should be encouraged to attend the social activities. We should encourage increased visiting families. And then also we really want to encourage social interaction between staff, residents, and families. One other example of an alternative for restraints is to provide help with toileting and then also to immediately clean up after incontinence. Let's review a few examples of restraint alternatives. Here again, we may offer food and drink, offer reading materials, or perhaps if there is a communal area where there's a puzzle, help the residents work on this puzzle. Distract or redirect interest. Give the person repetitive tasks to do. Sometimes people with dementia especially benefit from simple tasks like giving them a box of washcloths to fold or to sort out items like buttons into colors. Try and help them with relaxation techniques. Here again, you may give them a back rub or just listen to music. You want to provide familiar caregivers for these individuals and increase the number of caregivers available. Family and friends can sometimes fill in with caregiving needs. The use of a team approach in meeting the patient's needs is very important. A gentle approach, techniques to use with difficult patients, a calm voice, a gentle touch, decreasing the noise level, possibly listening to music is a way to reduce stress and agitation. The restraint guidelines, restraints may be used, but the Omnibus Reconciliation Act has given very strict guidelines for the application and use of restraints. The restraints can only be applied with a doctor's order, and we cannot use restraints unless the supervisor has approved their use and the caregivers have been trained in the appropriate use of these restraints. Restraint guidelines for use of restraints. The Omnibus Reconciliation Act set rules for the restraint use. It is important that you know the state laws and any facility or agency rules regarding the applying of restraints. Check to be sure that there is a doctor's order for the restraint use and that this has been incorporated into the care plan. You must also follow manufacturer's instructions for the applying of restraints. Never tie restraints to the side rails or other areas of the bed. Only tie the restraints to non-movable parts of the bed frame. Ensure that breasts or other skin areas are not caught up in the restraint. Place a call light within the person's reach and respond to this call light immediately. You must also document restraint use according to your facility's policies. Guidelines for ordered restraints. A restrained person must be consistently monitored. He or she must be checked on every 15 minutes. And during this regular check, you should do the following: release the restraint or discontinue per policy and care plan instructions. Offer help with toileting and check for incontinent episodes and provide care when needed. Offer fluids and food. Check the skin for signs of irritation and report the following: either change in color or red, purple, bluish, or gray or pale skin, and any discolored areas. Check for swelling of the body part and report it if it's present. Reposition the person and ambulate the person if they are able to ambulate. If any problems occur with the restraint, especially injury, the caregiver should notify the supervisor and complete an incident report as soon as possible according to the policy of the law and of the facility. Thank you. Here are some additional resources that you may want to explore.